Inside the Medical Center of Aurora, wherever new nurses gather, that's where you'll find Carrie Tilquist teaching, coaching, and leading. Her journey started as a critical care nurse 40 years ago.
Every patient is somebody's mom, somebody's dad, and we owe it to them to do the best we can and bring our skill set to the forefront.
As the ICU educator, Carrie's job is to mentor and develop critical care nurses.
There's so much out there, and you have to funnel that down into what I need to know for this particular patient diagnosis, this particular order set, on this particular day, whether it's a male, female, young, or old.
Carrie's dedication to new nurses led to a comprehensive orientation program used division-wide called the DEU, Dedicated Education Unit.
Carrie was very innovative in realizing 10, 15 years ago that the only way we were going to continue to have consistent, successful nursing at the bedside was to embrace the fact that we're going to have these new nurses that are coming in with absolutely no experience at all.
To keep track of a new nurse's progress, Carrie also developed the Critical Care Nursing Passport. It's a checklist of the basic skill sets needed to be a successful ICU nurse. It also tracks their professional journey. Carrie has mentored many of them.
It's just so rewarding now to see people that have gone through these programs now be managers, directors, flight nurses, and just very, very successful nurses at the bedside that are still happy there.
When I think about our most vulnerable population in the ICU, and then having a new graduate nurse serving that most vulnerable population, and carries her passport, her DEU, it makes that nurse feel comfortable caring for our vulnerable patients. That is the best of who we are. Carrie really is the best of who we are.
Her innovation, passion, and guidance to so many is why Carrie Tilquist is this year's recipient of the HCA Excellence in Nursing Award in the category of professional mentoring.
I'm just so grateful.
Even after 40 years being a nurse, Carrie has not lost that joy. She's an inspiration.
Some people are born knowing what they are meant to do. Ed Lee is one of those people.
I feel like something deep down inside that's what I was put here to do, is to help people and to take care of people.
At Medical City McKinney, Ed is the director of emergency services. His coworkers say while Ed has superior skill, it's his compassion towards patients and their families that sets him apart.
All of our staff have the skills and the medical knowledge to take care of whatever it is that they came through our doors for. It takes something else for us to truly treat that person as a person and not just what their condition is.
I knew within 5 minutes how special Ed was. He just had a servant heart, his intelligence. You could tell how much he really cared about people.
Ed refers to his coworkers as his second family and started something called the Critical Care Staff Debriefing. It's a closed-door, heart-to-heart private gathering after a particularly difficult day in the ER.
We definitely try and make sure that our staff have an outlet to be able to kind of voice their concerns and to be able to speak up and let that stuff out and not bottle it up.
Ed's always focusing in on the team, patient focused, mission driven, above all else, improvement of care of human life, and that's kind of Ed.
Ed's compassion extends outside the hospital as well, something his family has come to expect. For 2 weeks after Hurricane Harvey hit the Houston area, Ed led a 45-person mobile medical team. They set up and operated a field hospital treating hundreds of people.
They were completely on an island in essence. Almost as soon as we set up, there was already patients waiting to be seen. We were it. We were the only medical services really around.
For his servant heart, his focus on compassionate patient care and support of his team, Ed Lee is this year's recipient of the HCA Excellence in Nursing Award in the category of compassionate care.
Very deserving. Congratulations. You do some great things for the people around you, for the patients, for the families. Not bad for an Aggie, Ed.
I'd just like to say thank you and that I am so humble